Good morning. My name is Dr. Pankaj Jain. I am working as a consultant pulmonologist in Department of Respiratory Medicine, Jahangir Hospital, Pune. Today, I want to talk about pulmonary medicine and diseases related to chest. Pulmonology stands for diseases which affect the chest. What commonly diseases which we find presenting at us are bronchial asthma, allergic diseases affecting lung, which patients usually presents with long-standing cough, breathing trouble, cough production, blood in his sputum or cough, a fever, sound coming from the chest at the time of sleep or during night, sleep disturbances, snoring, headache or irritability when patient gets up in the morning due to lack of good quality sleep. So we have got a department of intervention pulmonology where we have got a bronchoscope, thoracoscope, so that we can actually under vision see the lesion or mass or tumor, take a biopsy from it and diagnose the disease. Then patients who are presenting with the fluid or water in their chest, it could be due to a lot of reasons like infections, for example tuberculosis. It can cause water in the chest. Then there are serious diseases like cancer of the lung or cancer of the pleura, like for example mesothelioma. They also present with the water in the chest. We remove the water, get it tested in our lab. We have got a very good lab with all the facilities and can get the diagnosis with the shortest period possible to rule out any serious disease affecting the lung. And that progressively increases over the period of few years to decade, leading to problems in leading a day-to-day life. And over the period, say on exposure to smoke for few decades, patient may land up in the serious diseases like lung cancer. So I just want to advise those patients or people who are smoking or consuming tobacco in any form, be it a gutka, do not do that or stop it immediately. But you may not have symptoms right now, but you may develop all these symptoms which I talked about over the period of next 10 years. We have anti-smoking clinic running in our hospital where we provide the drugs which will help in reducing or quitting the smoking habit. We provide psychological counseling and help in terms of support, be it medicine or psychological, to help the patient or person who is interested in quitting smoking so that he will quit or stop this habit. We have got excellent asthma clinic working at our hospital. So what does it cover? The asthma, bronchial asthma or allergic rhinitis. So patients who have got frequent symptoms related to having cough, breathing trouble, wheezing sound coming from their chest, frequent sneezing on exposure to dust or some particular chemical like for example deodorants or perfumes, or those patients who have got a family history or a first blood relative having these problems, they are potential for developing allergic diseases. Some patient will have only skin symptoms like development of rashes, itching, lacrimation like watery eyes, sneezing, headache, sinusitis. All these patients will get the proper diagnosis, the requisite testing. Depending on the allergy testing and the result of allergy testing, they can be provided the specific treatment and providing therefore a cure of their allergic disease. We also provide services about dietary advice, lifestyle modifications, rehabilitation services in terms of exercises, which exercises they should avoid, which exercises they can do. You will get a advice from the expert who is trained in that particular field related to particular disease and its symptoms. This whole comprehensive care is covered under one roof in the form of asthma and allergy clinic. Increasing prevalence of sleep disorder in our society, they do not get adequate attention and proper advice and care regarding sleep disorders. Now, sleep disorders, as for example, obstructive sleep apnea, is quite common but hardly attended or diagnosed in as and the awareness about that disease or entity is low. Even if patient gets awareness about this disease, they do not get expert advice regarding investigation and care about that disease. Be it insomnia, it could be acute or chronic, then parasomnias, restless leg syndromes. All these diseases affecting our quality of sleep and in turn leads to the decrease in productivity as well as increasing other diseases, for example hypertension, the reducing the quality of life, reducing productivity as well as increasing other disorders like hypertension, diabetes and stress level in patients' day-to-day life. So those sleep disorders can be diagnosed in Jahangir Hospital with the help of sleep study, which is known as a polysomnography. After the test, we'll be able to diagnose sleep disorder which is affecting and causing the patient's symptom, and depending on the result of the test, we can provide appropriate advice as well as treatment and rehabilitation services if need be.